Infectious diseases of the cardiovascular and lymphatic system. We've talked about this before, the fact that the cardiovascular and lymphatic system are very closely intertwined because both of them move fluids. We have the cardiovascular system that basically is a pickup and drop-off system. It picks up nutrients from your intestine and delivers them to the cells of the body, and it picks up the waste products from the cells of the body and delivers them to the kidneys for filtration. Because the cardiovascular system leaks fluid because of its exchanging task, we also have the lymphatic system. The lymphatic system has a specific purpose in the fact that it'll pick up whatever the cardiovascular system has leaked out. So the cardiovascular system, also known as the circulatory system, is composed of blood vessels and the heart. Its function is to provide tissues with oxygen and nutrients and carry away carbon dioxide and waste. Like I said, it's a pickup and drop-off system. The lymphatic system is actually closely related to the cardiovascular system. It collects fluid that has left the blood vessels and entered tissues. It filters it of infectious agents, then returns it to the blood. It is composed of the lymphatic vessels, so those tubes, the lymph nodes, so the pinto beans, and the spleen, the purple organ up here. Defenses of cardiovascular and lymphatic systems: you have the leukocytes. Remember, leuko is white, cytes is cells. Specifically the ones that do phagocytosis, so we're talking neutrophil, macrophage, and dendritic cell. We also have the lymphocytes. Those are going to be our B and T cells that are specific to the target that they attack. Terminology. Medical conditions that have the suffix emia automatically mean that it involves the blood. So if we're talking about viremia, viremia is going to be virus in the blood. Fungemia is going to be fungus in the blood. Bacteremia is the presence of bacteria in the blood. Septicemia. Septicemia is different because you may have bacteria in the blood, but instead of just being there static, it's actually reproducing. The fact that you've got it reproducing makes it a whole different ballgame to bacteremia. Septic shock. This is a phase that follows septicemia. It's composed of cascading immune responses that result in a decrease in blood pressure. One of the things that I had previously mentioned was when your body has an immune response, it'll cause your blood vessels to leak. The problem with that in a systemic fashion, if all of your blood vessels leak all at the same time, you're losing massive amounts of blood volume. That causes your blood pressure to drop. Unlike a water hose that is designed to stay open even if there's not water flowing through it, your cardiovascular system vessels have to have blood inside them pushing to keep them open. If there's not enough there, they'll actually deflate and it'll stop blood flow. With a lack of blood flow, you can have things like damage to organs. You can also, if you think about it, that could be your kidneys, it could be your brain, but either way, it would result in ultimately death. First disease we're going to talk about is malaria. This is a major issue worldwide. It threatens 40% of the world's population every year. Geographically, it is limited though. You've got South America, Africa, and Asia. So if you look here, South America, Africa, Asia. The reservoir is humans and vertebrate animals, but it is vector-borne, meaning that it goes through an insect before it gets to us. So in this case, it's the Anopheles mosquito that is the vector. Signs and symptoms. It has a 10-day incubation period, and in that incubation period, you have very generalized symptoms. Malaise, fatigue, aches, nausea, nothing really specific to go, it's malaria. Just you don't feel good, you're tired, your body hurts. That could be symptoms of the flu. So like I said, general, very, very general symptoms. As organisms reproduce in the bloodstream, they cause symptoms like chills, fever, and sweating. Now this is the thing with those symptoms. It rotates. Every 48 to 72 hours, you repeat chills, fever, sweating. chills, fever, sweating. Chills, fever, sweating. So it's repetitive in its cycle. In severe cases, symptoms can persist for weeks with no relief. It can lead to anemia. Because this affects your red blood cells and causes them to rupture, it can actually cause anemia because you're losing that iron when the red blood cells rupture. It can cause enlargement of the spleen, the liver, and the kidneys. And in cerebral malaria, remember, cerebral is your head, it can actually lead to the ultimate thing, which is coma and death. The pathogen, it's a protozoan called Plasmodium. Remember, protozoans are going to be eukaryotes, so they're not bacteria, they're eukaryotic cells. There are 4 species involved: Plasmodium malariae, Plasmodium vivax, Plasmodium falciparum, and Plasmodium ovale. Falciparum is the one that's the most virulent, and it's the one that causes the most severe cases. As far as treatment and prevention, quinine and artemisinin are going to be your treatments. As far as prevention goes, well, it's transmitted by the vector that is Anopheles mosquito. So mosquito abatement is a big thing. You want to try and kill the mosquitoes before they become mosquitoes. If you do know that you are traveling to one of these geographic locations, you want to try and limit the exposure that you have to mosquitoes. You want to wear long sleeves, you want to wear mosquito repellent, you want mosquito netting around your bed at night, you want to make sure that your windows are closed. You want to try and limit the mosquitoes' access to you. You can also do chemoprophylaxis. If you know you're going to one of these geographic areas, you can start taking the treatments as a preventative. When I say prophylactic, it means that I'm treating before I get the disease. So the facts about malaria. It's a serious disease that is preventable and treatable. It's caused by Plasmodium parasites. Humans get infected via the mosquito bites that I just talked about. There are 97 countries and territories that have ongoing transmission of malaria, at least there was in 2015. 3.2 billion people are at risk of malaria worldwide. These countries that are here have a lot of people, so anybody who's there is at risk. Each year, over 10,000 travelers are reported to come home with malaria, not realizing it until they become ill. The symptoms, if we're talking mild to moderate, we're talking fever, sweating, headache, muscle aches, fatigue. Getting more severe, you're talking shaking with rigors and chills, vomiting, diarrhea, and again, it can be fatal if you don't get it treated. What's the best thing for you? Early diagnosis. We can catch it early, we can treat it early, and we can kind of prevent the progression that you see here. Pregnant women are at very high risk from dying of complications of malaria. When you are pregnant, you actually make more red blood cells because your baby is taking your oxygen. They don't breathe, so they have to take it from you. If these are killing your red blood cells, if they're damaging your red blood cells, it's very hard to maintain that amount of oxygen transfer and the ability to carry the amount of oxygen that you need to. If that's true, what happens if I stop giving you oxygen? Every 2 minutes, a child dies of malaria in sub-Saharan Africa. That's awful. The ABCD of malaria prevention. A, awareness. You need to be aware of the risk. You need to be aware of the symptoms. B is bite prevention. I said this before, you need to avoid being bitten by mosquitoes, especially between dusk and dawn. Those are the time frames when they're kind of the most prevalent. Chemoprophylaxis. Remember, prophylactic means I'm treating before I get the disease. If prescribed for you, chemoprophylaxis, antimalarial medication, can basically prevent the infection. Diagnosis. Immediately seek diagnosis and treatment if a fever develops 1 week or more after being in a malarial area. You got to remember that it's not necessarily just going to be a few days, you get back, you get sick. It can actually be delayed for up to a year. So something to kind of keep in mind. Looking at the life cycle of the malarial parasite. You can read this. This is what I'm going to say. So an infected mosquito bites a human and it injects an asexual sporozoite into the human host. It doesn't have male, female, it's just the asexual sporozoite. The sporozoite circulates through the body, eventually migrating to the liver to undergo schizogeny, which is asexual division. And that produces merozytes. These are the things that erupt from the liver. Merozytes will attach to the red blood cells. You can see here, invade them, and they produce gametophytes while in the red blood cells. Now remember I said these are asexual that are getting injected, right? Gametophytes are male and female. It ends up being the gametophytes that are released to circulate in the bloodstream. Mosquito draws up the gametocytes from an infected person when they bite them, and the life cycle begins again, where the oocyst forms and produces sporozytes, and then you go back to step one. If a mosquito is infected, it takes that infected mosquito to infect somebody. If a mosquito doesn't have it, they're not going to give it to you, which I know seems very obvious, but so there are clinical trials going on with different vaccines to try and treat malaria. At least there were in 2012. You can see where the pins are, where it's being tested. Despite major advances in the global fight against malaria, we're still in need of quality treatment that the organisms are not resistant to. We need to limit the antibiotic resistance issues that have come up. There is also a need for an effective, cost-efficient vaccine. If you look at the map at the countries where this is, a lot of those countries are very poor countries. If you make a vaccination that is completely out of somebody's price range, they're never going to be able to afford it. So you want something that's effective and you want something that is cost efficient. It is affordable. There are efforts currently to monitor the antibiotic resistance that we're seeing, and there are multiple vaccines in the research process. Again, you can kind of see here, having a vaccination would be fantastic, but it's still in development. Although, just because I'm thinking about it, the RNA vaccine may be a good way to go. HIV. It's a disease of the lymphatic system, and it can spread through the blood and through the body fluids. The reservoir for HIV, human immunodeficiency virus, is humans. Transmission route is going to be direct contact. You either have to have sexual intercourse with somebody who has it, or you need to come in contact with blood or blood products. Signs and symptoms. This is the scary part with HIV. It can take months or it can take years for symptoms to show because of how it infects your body. It goes into your helper T cells, takes its RNA, changes it into DNA, and then inserts in the genome of that T cell, the helper T cell. And it can lay there dormant for months, for a year. It will lay there dormant for a really long time, and you may never develop symptoms because it's pretty much hibernating. The initial symptoms are going to be things like fatigue and diarrhea, weight loss, unexplained weight loss. You know, if you're on a diet, that explains weight loss. But if you're eating the same amount of calories and exercising the same amount before you got it to after and you're still losing weight, that's a little sketchy. As the viruses begin to increase in number over time, because it infects your CD4 cells, your helper T cells, the number of CD4 cells begin to decline. At a certain level, you get AIDS-defining illness. So human immunodeficiency and or acquired immune deficiency syndrome. They're technically two different things. HIV just means you have the virus. AIDS means that it has done so much damage that you literally have a very, I don't want to say useless immune system, but so damaged that it's practically useless. Remember what I said when we talked about specific immunity. Everything under specific immunity's umbrella hinges on that helper T cell. If this virus is coming in and damaging all of your helper T cells, you literally have nothing to begin your specific immune response with because they've been damaged. That's a bad thing. So, wasting of body mass due to weight loss and diarrhea, that's one symptom of AIDS-defining illness. Fever, fatigue, sore throat, night sweats, as well as opportunistic infections and opportunistic cancers that start to take over the body. Most people who get to the stage of AIDS are not going to die from AIDS or HIV. That's not the way it works. Most people who get these diseases are actually dying from other infections that take advantage of the fact that your immune system doesn't work. With that in mind, things like opportunistic cancers happen. So I'm going to show you a picture in a minute of a specific type of skin cancer that we all get. It's something that happens, but normally if you have a normal functioning immune system, it comes in, it takes care of it, and you never even know you have it. People in the advanced stages of HIV that have gotten to the AIDS stage get these big, huge growths on their skin. They look like huge moles. But because they have no immune system, it takes over and they end up with them all over the place. Their face, their chest, their arms, their legs, everywhere. Pathogen information. So HIV is human immunodeficiency virus. It's a retrovirus and it integrates and hides out in the host's genome. This causes a delay in symptoms. Like I said, you can have it for months or years and you never know because it's just kind of hanging out in your cell. It doesn't ever leave that cell. So for all intents and purposes, I'm not making funky proteins, it's just kind of hiding out in there. HIV enters the body through the mucous membrane or the skin. Then it travels to the immune cells, specifically, again, our CD4 cells, our helper T cells, where the virus lives and reproduces. Just like most viruses, as it reproduces and reproduces inside the cell, it's going to cause the cell to lyse, to break. So when that happens, we lose that CD4 cell. It's damaged, it's gone, which means that if something infects your body that specific helper T cell would have recognized, it's gone. There's no cell to do that now. That right there is what decreases our CD4 cell population. If you know anybody who has HIV, one of the things that they always get in and they get tested for at the doctor is a CD4 count. They're looking to see how many of those CD4 cells they actually have. Once that number is below a certain threshold, then they call it AIDS, because now I have no immune system. I should, but I don't. Treatment and prevention. Right now, there is no cure for this. There is no real treatment. I can help to stop the virus from growing in large numbers, but I can't get it out of you. Once you have it, you have it. HAART, highly active antiretroviral therapy, is a cocktail treatment that combines multiple drugs to target different aspects of the virus. It is very common in the current day for us to have somebody who has HIV live a very long life. They have come up with medications that are effective at controlling the amount of virus that is in your body, but it's not something that can fix it. It's gonna be there regardless. It's just that it's not multiplying anymore, so it's not causing any damage. So back in the day when HIV was first kind of around, when people first started taking notice of it, the treatments were pretty bad. You were taking 17 to 27 pills a day, and the side effects of those medications would make you so ill that you couldn't get out of bed some days. You have to wear diapers because you would, poop your pants, things like that. Those types of medications have now evolved, and we've made better medications, but it's still something that you have to take forever. If you get HIV, you take this medication forever, because if you don't, the virus will start to replicate and it'll destroy your immune system. Prevention. So I said here that sexual intercourse and contact with blood or blood products, wear a condom when you're having sexual intercourse. Very simple. You can avoid sexual contact altogether with anybody who you know is infected, and avoid IV drug use. Because people who use drugs tend to share needles and use the same needle over and over again, it's a quick way to get blood-to-blood contact. HIV isn't the most hardy virus. If it's exposed to air, it pretty much dies. That's why you can't get it from like a toilet seat or even from kissing somebody who has HIV, because there's air in your mouth. But if you're talking about a needle, that needle isn't necessarily exposed to the air, so it can live there. And if you're switching from person to person, that can help to transfer the virus. So this is what the virus looks like. You can see the spike proteins on top. Symptoms: your lymph nodes will swell. Respiratory wise, you may have a dry cough. You can end up with pneumonia or even a sore throat. You'll have muscle pain, joint pain, headache, difficulty concentrating. Skin rashes are fairly common. Fever, night sweats, With your digestive system, you may experience nausea, vomiting, diarrhea. Your nails may actually thicken and start to curve. And like I said, you may experience weight loss and fatigue that's just not explained. So, Kaposi sarcoma, these are actually cancer lesions. It's a type of skin cancer, and like I said, we all get it, but normally our immune system takes care of it, so we never even know that it happened. People in the more advanced stages of HIV will display these sarcoma on their skin. In the 70s and in the 80s, this was one of those defining factors that when people saw it on you, they automatically knew that you had HIV. And unfortunately, for the person that had HIV, there was no way for their body to fix it because their immune system was so compromised, the thing that normally would take care of this couldn't. It is not a very common cancer, but because of their compromised immune system, it is opportunistic in this case. So, HIV news. Since HIV infections and the AIDS epidemic began in the early 80s, more than 25 million people have died worldwide. Approximately 33 million people are currently infected worldwide, and approximately 1 million people in the US are currently infected. So I think a lot of people, when you mention, AIDS came originally from monkeys or primates or whatever you want to call it, they think, somebody had sex with a monkey. That isn't the way that works. Most likely, because of where it began, monkeys are a food source. Somebody was butchering a monkey that had it and cut their hand at the same time, and that was how it initially transferred over. It would be very easy for that to happen if there's an open wound, and most likely that's how things started. There are a rare number of people infected with HIV that are known as non-progressors. This population of people is 1% of HIV positive individuals that remain free of the AIDS-defining illness. It never progresses. Yes, they carry HIV, but they never get to the point that their T cell count is so low that their immune system is compromised. One of the reasons that they believe this happens is because of a lack of receptors on the CD4 cell needed for infection, or they're infected with a weakened or mutant strain of the virus. So remember, if I'm a virus, these spike proteins are my key to get into a cell. If you don't have the right log, this isn't going to be as effective. So, functional cure. In 2013, after designing a medication, there were a small fraction of patients in a French research project that were treated, and within the first 2 months of infection, they were able to stop their antiretroviral therapy, the drug cocktail that they were on. And when they did, they didn't see the rebound of HIV. It didn't come back in high numbers. This actually was at the Institut Pasteur in Paris. While all 14 still have HIV, in most cases, it would only be detected with really sensitive testing. If you were to do the basic standardized tests that you would see, let's say in a hospital, they wouldn't know it was there. So something to understand here. While the infection is under control, it didn't go away. HIV is still there. That's why it's defined as a functional cure. It's not a sterilizing cure where the HIV went away.